Hi, good afternoon. My name is Christopher Martiliano, and I am a student at Pensacola State College in the Nursing BSN program. Today, I will be doing the head-to-toe assessment for you with a friend of mine, Aaron Reeves, who will be playing my patient. I'm going to show you my ID for verification. Okay. Awesome. Well, I'm going to start this head-to-toe assessment by washing my hands. My hands have been washed. Now I'm going to start the assessment by introducing my patient, but just for a general background, my patient is 25 years old, he is 5'11", and approximately 180 pounds. Mr. Aaron Reeves, can you come in? How's it going, man?
Hey Chris, how you doing?
I'm good, buddy. You doing all right today?
Yeah, yes sir, doing good.
Very good, very good. All right, we're going to start this assessment by something really simple, man. You see that eye chart over there for me?
I do, yeah.
That's called a Snellen eye chart, and what I'm going to have you do is cover your right eye for me and read the smallest letters you can see, and then we'll do the same thing with the other eye, okay?
Okay.
Awesome.
Right, I can do
Go ahead and stand behind that line for me real quick.
All right.
And then cover your right eye, and then can you read the smallest print you can see?
C, E, F, G.
Perfect. Nice. Okay. And cover your left eye up and tell me what you see.
C, E, F, G.
Nice, man. According to that chart, you have 20/20 vision. Very
Is
good.
that good?
Yeah, that's very good.
Awesome.
All right. Awesome. Well, have a seat for me real quick, okay?
Right. Yeah.
Perfect. Well, what I'm going to do now is I'm just going to do a general, some general things such as take your vital signs, and we'll start off by taking your pulse.
Okay.
I'll be taking your pulse from your radial wrist here, okay?
All right.
Awesome. And for 1 complete minute, I'll count your pulse. Awesome, man. Pulse is very strong and palpable, and you're right at like 72 beats per minute. Okay. Next, I'm going to check your cap refills, and by pressing on your fingertips here, and they should return within 3 seconds. Oh, and they do. Very good. Next, I'm going to be checking your blood pressure.
Okay. What's a normal pulse? Like, is it like 70 or 100 or something?
Yeah, a normal pulse is anywhere between 60 to about 100 beats per minute.
60 to 100.
Yep.
Gotcha.
Yep, perfect, man. Good question, though. All right. Got some big guns here, man. Been working out?
A little bit, yeah. I lift and try to stay active.
Cool. Very good. All right. You can just rest your arm for me. I'm going to check your blood pressure. Blood pressure is nice, man. 120/75.
20 over 75.
Right there.
Is that good?
That's, yeah, very good.
Awesome.
Okay. Next, I'm gonna check. We'll check your head for symmetry and make sure there's no bumps or bruises and anything, no lacerations, and for equal hair spacing. Okay.
All right.
Awesome. Quick, lean forward for me. Okay, looks good up there, man. Very good. All right, next I will be doing an eye exam for you, okay?
All right.
First, I'm gonna check your peripheral vision. Can you cover one of your eyes? Cover your right eye for me real
Sure,
quick.
yeah.
Okay. Tell me when you see my fingers.
Now.
Okay. Can you cover up the other eye for me?
Yeah.
Okay. And then tell me when you see my fingers.
Now.
Okay. Nice. All right. I'll be checking your eyes out with my ophthalmoscope, and I'll be shining a light into your eye, and it'll be checking for your ocular fundus, your sclera, your optic disc, and your iris. Okay.
Okay. Yeah.
Good.
Optic disc.
Yep. Optic disc.
Cool.
Funny word, isn't it?
Yeah.
All right. Comes the light. Just look past me real quick.
All right.
Very good. Okay. You look good, man.
All right.
All right.
I haven't had any vision problems.
Okay. Yeah, with your 20/20 vision, I doubt you had any eye problems. Well, I'm gonna check your pupil reaction real quick
Okay.
with my my otoscope light. Okay. Just look ahead for me, and
Okay.
good. Very nice. All right. Moving on. We'll be doing your. We'll be checking your ears. Okay. Any problem hearing anything?
No, I have pretty good hearing.
Okay.
Haven't noticed anything.
Okay. Awesome. I'm going to be checking your ears with my otoscope real quick. Okay.
Okay.
I'll just be shining a light down there, and I'll be looking at your tympanic membrane and your outer canal. Okay.
Okay. Yeah.
Okay. tragus looks good.
Is that
And
this part right here?
Yep.
Where's that at?
exactly where you pointed.
Okay.
Yeah, it's perfect. And your outer canal looks very clean.
I think my sister had her tragus pierced, so
Oh, did she?
that's why I knew where
Yeah.
it was.
You're a smart fella. Okay. Next, I will be doing a whisper test to continue our hearing.
A whisper test.
Yep. Okay. So what I'm gonna have you do is cover one ear real quick,
Okay.
and I'll whisper something on this side and tell me if you hear it. Okay. Awesome.
Monday. Tuesday.
Yeah. Nice. Good hearing, man. Very good. All right. Next hearing test that we're gonna do is the Weber and Rhine test. Are you familiar with the tuning fork?
Is that what that is?
This is a tuning fork. Yep.
Okay.
And what I'll do is I'll cause it to vibrate, and the Weber test I'll put on top of your head, right in the middle, and you tell me when you if you can hear the sound in both ears and equal. Okay.
Okay. All right.
All right. We'll
Easy
start
enough.
off with that. Okay.
Yes, sir.
All right.
Oh yeah. I hear it in both ears, and it sounds the same.
Okay. Very good. And next is called the Rhine test. Very similar. What I'll do is I'll hit it again, and I'll put it right behind your ear, right on that bone, and you tell me when you stop feeling it
Mm-hmm.
and when you stop hearing it. Okay.
All right. We'll do.
All right, and we'll do both ears, okay?
All right.
All right.
Yeah. Stop feeling it.
Okay.
And I stopped hearing it.
Okay. Now we'll do the other side, all right?
All right. Okay. I stopped feeling it. And I stopped hearing it.
Very good. You have some really good ears. You do hear pretty well.
Thanks, man.
Okay. Next, we'll be moving on to your nose. I'm going to be looking up there just to see if everything's okay. Have you had any smelling problems or anything like that lately?
No, I seem to be able to smell pretty good.
Okay.
That's when dinner's ready.
Yeah,
Yeah.
me too, man. All right, I'm gonna look up there real quick. Okay, everything looks like it's in order up there. Looks good. Okay, moving on. I'll be inspecting your mouth, just to see if everything's okay in there too. Okay.
All right.
All right, I'm gonna have you open your mouth and say "ah" for me. And by doing that, I'm checking cranial nerves 9 and 10. Okay. All right. Can you say "ah"? Ah. Yeah. That's the gag reflex.
Yeah, yeah.
Got it, huh? Okay. Perfect. Okay. Next, I was looking at your tonsils back there. I see you still have them, but they're not swollen. Give them a +1, and your uvula looks really good too.
What's the uvula? Is that
It's
the
that
thing
little
that hangs
dang.
down?
Yep, it's that little dangly thing that hangs in the back of your.
Okay, I was wondering what that was called.
Yeah, very good. Okay, sweet. Now we're gonna move on, and I'm gonna check your neck for your lymph nodes. Okay.
All right.
All right. Any pain or anything here?
No.
Okay. How about here?
No.
Okay. Any pain or anything here? Okay. Very Okay. And then what I'm gonna have you do is have a range of motion test. Okay.
Okay.
What I'm gonna have you do is put my hand right here, and can you turn head to the right or towards my hand? Thank you. Very good. All right. And nice and strong. You got some strong neck muscles. Very good. Okay, so moving on. I'm gonna stand right behind you, and then I'm gonna I'll be checking the reverse.
Is this where you check my thyroid, or?
Yeah.
Okay.
Check.
Gotcha.
Yeah. Okay. Very good. Okay. Nice. All right. Well, next I'm gonna ask you to I'm gonna put my hand here and turn your head and down. Okay. And very good. And the other way. Very good. All right. Very good. So next, I'm gonna have to ask you to take your shirt off, and I'm gonna check your thorax and your back. Okay.
Okay. My thorax, my chest.
Yeah.
Okay. Gotcha.
Check the back of your chest.
Mind if I set my shirt over here?
Yeah, you can put it right there, buddy. Okay. What I'll be doing here is I'll be just looking for symmetrical. Looks good. You're good. So what I'm going to do is I'm going to listen to your lungs back here real quick, okay?
Alright.
Nice deep breath. Nice deep breath. Deep breath. Nice deep breath. Nice deep breath. Nice deep breath. Very good. And next I'm going to percuss back here. That means that I'll be tapping on your shoulders and now I'm going to be feeling for tactile firmitis, so I'm going to have you say 99 for me, okay?
Okay.
All right, ready and go.
99. 99. 99. 99. 99. 99.
Very good, very good. Awesome. All right. Now I'm going to come back up front, and I'm going to check your range of motion in your shoulders. Can you shrug your shoulders for me? Very good, very good. Next, we'll be doing, can you hold your arms out for me towards the side?
Yeah.
Okay. Any pain there?
No.
No? Okay. Can you rotate your arms forward, rotate them back for me? Very good. No pain.
No pain.
Okay. I'm going to listen to the front of your chest now.
Okay.
And just take a nice deep breath for me. Nice deep breath. Okay. Very good. Heart, and it sounds really strong. Very nice. Okay, next I am gonna ask you to lie flat for me, okay?
Yeah, sure.
Very good.
Still got my shoes on, is that okay?
Yeah, no, we're gonna take those off for
Okay.
a second. Or you mind if I take them off?
Yeah, go ahead, man.
Okay. All right, I'm gonna take your socks off, okay?
Sure.
Okay. Sweet. Well, what I'm gonna do now is, can you put your hands by your side?
Yeah.
And I'm just gonna inspect your abdomen. Okay. Very good, nice and even. And what I'm gonna do next is I'm gonna ask you to turn to your left side so I can listen to your ankle pulse. Okay.
Okay.
Okay. Okay. Very good. Sounds really good. All right. Next, I'm gonna listen to your stomach. I'm gonna listen in all 4 quadrants. Okay.
Okay.
Very good. Very good. And then next, I'm gonna palpate your stomach. Tell me if you feel any pain in any of these as I'm rubbing your stomach. Okay.
No pain.
No pain. No pain.
No.
No pain. No. Okay. Very good. And now I'm gonna percuss your stomach. Very good. I was basically checking for your liver and spleen, and there's no distension, and I can't feel them, so that's good news.
Okay.
Okay. All right. So while you're lying back, what I'm gonna do is I'm gonna check your lower extremities real quick. I'm gonna start checking your pulse behind your knee, also known as your popliteal pulse. Okay.
Okay.
All right. Okay. And then I'm gonna go towards the back of your foot, and this is your posterior tibials. And finally, right above your foot, your dorsalis pedis, okay? Very good. All right, I'm gonna ask you to push against my hand like you're driving a car. All right, and then pull against my hand and bring your nose to your toes to your nose. Very good, very good, awesome. Next, while you're still lying flat, is I'm going to ask you to flex your hips for me, okay? So what I'm going to have you do is, can you bring this left leg to here? Very good. Can you do this one? Very nice. And then can you do both at the same time? Very good. And then I'm gonna check the flexibility of your hip. I'm gonna pull this here and then move it towards the inside. Any pain there?
No,
Any pain towards this way?
not at all.
Okay, put that back down. Pain here. Any pain here? No. And towards there?
Nope.
No pain. All right. I'll put that back down. Very good. Very good. Can you tell? Get your right foot and rub your left shin.
Like this?
Yep. Go down your shin. Nice, smooth. Up again. Come back up. Very good. And then can you do it with the other leg?
Yeah.
Very good. Awesome. Very good. All right. Well, can you sit back on the edge of the bed for me real quick?
Yeah, man.
What we're going to do next is sharp and dull superficial pain reaction.
Okay.
All right. So what I'll have you do is close your eyes, and I'll either poke you with a sharp side or a dull side.
Okay.
And you tell me where. Tell me if it's dull or sharp. Okay.
All right, we'll do.
Okay.
Sharp. Dull. Sharp. Sharp. Dull. Dull.
Very good. And then I'm gonna do it down by your legs also.
Okay.
All right. So
Dull. Dull. Sharp. 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 Dull.
very good. All right. Well, while I have my handy dandy reflex hammer out, I'm going to check the reflexes in your brachial.
Okay.
And very good. And in your triceps, okay? Very good. Very good. Next, we're going to move down to your patella. If you want to scoot over to the bed for me real quick, there you go. Very good. All right, very good. Next, what we'll do is we'll check your, let's see, I'm going to check your Achilles reflex also while I'm down here, okay?
Okay.
All right. Very good. And again, since I'm down here, I'll check. All right. That is known as the Babinski reflex. You have it as a child, but since you're older adult, you lose it, so you're negative for Babinski.
So I don't have a Babinski
Yep.
reflex?
Nope.
So that's a good thing?
Yep. Very
Alright,
good.
Cool.
All right. Okay, man, we're almost there, dude. So what I'm gonna have you do now is, can you stand for me?
Yeah, would you mind if I put my shoes and socks
Yeah,
back on?
go ahead.
Okay. Oh.
Very good, man. Okay, so what I'll have you do is stand right here,
Mm-hmm.
and if you can you walk heel to toe for me? Very good. Very good. Very good. Very good. You get to the end of the bed, go ahead and turn back around and walk heel to toe from the back.
Same way?
Same way. Yep. There you go. Very good. Okay. Now I'm going to ask you to walk on your heels and walk back on your toes. Okay.
So heels And then on the way back, tiptoes?
Yep.
Okay.
There you go. Okay. All right. Very good, man. Very nice. So just stand right in front of me real quick. Face this way. Can you stand with one leg? Very good. Can you do a squat? Squat standing on one leg. Squat. Very nice. And then the other leg. Very good. Very good. All right. What I'm going to ask you to do next is I'm going to ask you to turn around, and can you bend at the waist so I can look at your back? Very good. Awesome. All right. Stand back up. What I'm going to do is I'm going to stabilize your hips, and can you bend side to side? Very good. All right. And then can you go back and forth? Okay, and can you rotate your hips? There you go. Very nice. All right. Very good, man. Good shape. All right. Normally, we would do a genitalia and rectum exam, but we're gonna not do that today. Okay.
Sounds good. Sounds good.
Okay. Very good. And just because guy to guy, when you're getting to that age, you just want to make sure that you're. You know anything about testicular cancer?
No, I hope I don't get it or
Right.
whatever. But
Well, the first preventative is always checking yourself. So doing like a self testicular exam
okay.
is always a very good practice to have. It's best to do it when you just get out of the shower where everything's nice and just relaxed. What you do is you use your 3 fingers and you just, with one testicle, just rotate it between your fingers, and if you notice any bumps, nodules, or any pain, you might want to have to come in and want to see us, okay?
And how often do you do that?
And once a month
Once a month?
is good enough.
Okay.
Yeah. So if that's something that you definitely need to keep in mind in the future, okay?
Awesome, man.
Very good. You can put your shirt back on, and we're done.
Perfect, man. Well, listen, appreciate you doing the assessment for me and everything and checking me out. I hope you make a great grade.
Thanks,
And
man.
guess we'll see you around next year, okay?
All right.